All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us for the monthly Strengthening Families Networking webinar for September. Today, we're talking about protective factors approaches to supporting resource parents, an exciting topic, and I'm glad that many people signed up to join us today and were interested in the topic. I hope that you will share your experiences and thoughts as well as listening to those who are presenting today. I'm going to ask all our presenters to mute themselves because I hear a little bit of background noise there. So please do mute yourself if you're not speaking. My name is Kailen O'Connor from the Center for the Study of Social Policy. I will quickly run through our agenda here, just so that everybody knows what we're covering today. I'll share some updates from CSSP. Meryl Levine
Excuse me, Kailen?
Yes.
Would you go ahead and show your screen?
Oh, I thought I had clicked that button. Thank you very much. So many buttons to click right as we get started. Okay, that should work now. Thank you. All right, so we are going to have updates from CSSP and from the National Alliance of Children's Trust Funds, Trust and Prevention Funds, who are our partner in putting on these webinars. Then we will hear about CSSP's Youth Thrive project, and particularly their Kinship Parent Education and Support project from Leonard Burton, my colleague at CSSP. I will talk a little bit about a new tool we have about self-care for kinship care providers. Then we're going to hear from Robin Harvey from Be Strong Families about their work with foster parents, which includes supporting shared parenting between foster parents and birth parents. And then Kate Beejan from Rhode Island is going to talk about state experiences and ask you for your thoughts and experiences and questions. Hope to get a good discussion going there. So without further ado, I'll say a little bit about these webinars. We hold these each month. It's an open invitation to anyone who's using the Protective Factors Framework or coordinating Strengthening Families efforts. As I mentioned, CSSP and the National Alliance of Children's Trust and Prevention Funds jointly convene these. We coordinate the topics and guest speakers, and we have started inviting volunteers from the Strengthening Families National Network to also suggest topics and coordinate webinars at times. And happy that this topic today was suggested by Kate in Rhode Island. We do post the recordings and materials from the webinars. The Alliance posts those on a Google site. The address is there, and you'll always see a link to that with follow-up information in the e-update monthly newsletter that goes out, which is probably where you got the invitation to this webinar. A couple webinar tips. If you're having audio problems, please check where your connection is coming from. And right now I'm hearing a lot of background noise. I think we may need to mute some of our speakers temporarily here at least, and we will sort that out as we go. I just want to make sure we're not getting a lot of fuzz in the background. So please do, if you're having audio problems, check that you are letting GoToWebinar know whether you're using your phone or mic and speakers. Often that's the problem. If you're using both, there will be a large echo. And there are some tips there on your screen. I'm not going to walk through all of them, but just wanted you to know there's help available. If you're having trouble with audio, feel free to type it into the questions box, and Trish or I will try to help you. Okay, as I think you know, we do these webinars on the second Thursday of each month at this time. And in October, we'll be talking about quality rating and improvement systems and how states and other systems are promoting family engagement in those. On November 12th, we'll hear about prevention of child neglect, which is a big body of work that the National Alliance of Children's Trust and Prevention Funds has been working on. And December 10th, we'll talk about reaching family, friend, and neighbor care providers, which is going to be coordinated by Nina Sazer-O'Donnell. So lots of interesting topics coming up. Put those on your calendar now, and you'll get the specific registration information as each of those comes closer. Okay, I'm going to share just a couple of updates from CSSP before we get into the topic for today. We do have a new parent guide available. Lots of people have been downloading that and excited about it since it was announced in our last e-update, but I wanted to make sure you all know about it. We did get great feedback from members of the Friends Parent Advisory Committee and from some network members who heard about it on one of these webinars and looked at it and gave us some feedback. The final brochure is available on our website now at the link that's on your screen. And you'll also see in the webinar panel today, there are a list of handouts. And there are two versions of this brochure available in that panel. One is called Parent Brochure for Booklet Printing. So that's the one you can use if you want to print this out and fold it and staple it and give it to parents. The other one that's just called SF Parent Brochure is just if you want to look at it on screen. So please do use that. We're always excited when we have Strengthening Families information in parent-friendly language, and in this case, really helpful for people to think about their own protective factors and how to keep their family strong. I also wanted to make sure that everybody knows we are releasing one module at a time of a Strengthening Families scripted curriculum from CSSP. 3 modules are now available. There are 8 modules in all, and my colleague Nilofer Hassan developed these in partnership with different jurisdictions when they were using Strengthening Families in their child welfare work. So the content of these modules, a lot of it is very specific to child welfare, some of it is not. And we encourage you to take a look at it and see if there's anything that you could use for the audiences that you're talking to about Strengthening Families. Each module includes a set of slides, a script, which we don't expect anyone to follow word for word, but is a nice backstop to make sure you're covering all the points you need to, and some activities for most of the modules, activities to help people, internalize the information about protective factors and to go through some case studies and things like that in a child welfare context. So as I said, we're releasing one module per month. The first 3 are out now, and I did want to show you where those are on our website because I know our website can be overwhelming, but when you go to Strengthening Families, there are 4 categories across the top, and the practice section is where you will find this under training and professional development. You just expand that line and scroll down to scripted curriculum. So you see the first module is an introduction to Strengthening Families. The second module goes in depth on the 5 protective factors. The third one is actually about Youth Thrive, which we're going to hear a little bit about today as well. And coming soon, the 4th one, I think a lot of people will find useful. It's about trauma and brain development and includes protective factors approach for talking about how parents or caregivers are impacted when they're caring for a child who has suffered from trauma. So those will continue coming out a month at a time, and we hope that you'll use them. We especially are hopeful that child welfare training academies might start incorporating some of this content into their trainings. We've packaged it up nicely so that people can take it and use it in whatever way would be useful. Okay. With that, I'm going to hand over to Meryl Levine from the National Alliance of Children's Trust and Prevention Funds, and she's going to share some information about work that they're doing. Meryl, are you there?
Yes, I am.
Wonderful.
Can you hear me?
Yes.
Okay. Hi, everyone. I'm Meryl Levine, a senior consultant with the National Alliance of Children's Trust and Prevention Funds, and I'm happy to be here today. I wanted to update you on a lot of the exciting activities that have been happening with an initiative that we call the BirthParent National Network. This is a dynamic network that includes birth parents and organizational members who are interested in doing policy work. And so I wanted to share with you a little bit more in terms of the kinds of activities that we're involved with. We are a growing network. We've been in existence for a little bit over close to 2 years now, and we started out with 18 organizational members, and now we have 30 organizational members and over 80 parent members that are a part of the network itself. Our goals and efforts are focused on strategizing ways to promote and support parents as partners in doing prevention strategies and child welfare system reform. And the way that the parents would be doing that would be educating policymakers around what are the needs and gaps in terms of services that families need to have. So we are really, really excited as we continue to move forward, and I will talk to you as we do go forward, but the Alliance is partnering with Casey Family Programs to implement this particular network. And so we are able to support parents in being able to talk with policymakers. And so we look for parents who are interested in doing public speaking and speaking about their different challenges and issues that they may have been involved with, either with the system or at risk of being involved with the child welfare system. We will provide them with the tools, we'll help prepare them for making presentations to policymakers. We provide assistance with travel and other kinds of logistical issues if they are asked to do a presentation. And we are always looking for organizations that are willing to support and help us in terms of bringing these parents forward to their different policymakers. It is a national effort. We are continuing to grow all the time, and we are certainly welcoming that new members do join. If you could take us to the next slide, Kailen, we could actually go and share with you a couple of really exciting activities that parents have been involved with so far. We actually had recently 2 parents from the BirthParent National Network participate in roundtable discussions on prevention at the White House. So that was really, really exciting. We've also had a number of parents actually testify in front of the Commission to eliminate child abuse and neglect fatalities. And again, just seeing all these different kinds of examples, we as the network help to support them in terms of being able to be ready to do these kinds of discussions. We actually prep with them, we rehearse with them, talk with them about what they're going to talk about when they go to these different kinds of events. We recently had another parent actually do some written and oral testimony to the Senate Finance Committee. So really, really exciting movement happening now because policymakers are really interested in hearing what birth parents have to say in terms of directions for new services and needs that need to be met for families. Our effort through the BirthParent National Network is to really help educate policymakers around the need to realign funding, the child welfare funding, and instead of putting so many dollars into the foster care system, we're really looking to help educate policymakers around realigning the funding so that more money can go into prevention, more money can go into helping support families keep their children within their own homes and find the resources to help support these families so that we can strengthen their families. So this is a really, really great opportunity for any parents that are interested in wanting to learn and engage in policy work. We're interested, we'll do training and provide them with the necessary supports to be able to do that. And one of the things that we are doing this year, it is a virtual network, so we do meet primarily by webinar. We meet every other month. And if you can take me to the next slide, Kailen, in November, our plans are to actually hold what we call the very first virtual convening, which is really going to be a series of different workshops that will be discussing different key issues around different topics relating to policies. And so we're looking at really talking in terms of a theme where parents' roles are involved in transforming systems. That's what we're going to focus this particular first virtual convening on. In order to attend that convening, we're offering it only to the members of the actual network. So if you know of parents or different organizations that are definitely interested in joining, we would welcome you connect with us. The Alliance does have a web page in which you can get more information about the BirthParent National Network. And certainly you can feel free to contact me as well in terms of getting more information about the virtual convening. But we do have our 3 dates confirmed right now for that convening, which is scheduled on Tuesday, November 3rd, Tuesday, November 10th, and Thursday, November 19th. It's really going to be a series of 3 different 2-hour sessions. And we have some of our speakers confirmed, but we're still in the throes of still finalizing some of them. We do have Dr. Sanders from Casey Family Programs who will be presenting on Tuesday, November 10th, and he will be our opening presenter on that particular day. We're really excited. He's going to be talking about some of the recommendations that are coming out from the Commission to eliminate child abuse and neglect fatalities. And he's also going to be talking about some of the key trends and directions of making some different reforms in the child welfare system across the nation. So that should be a really, really exciting workshop. We will have a lot of other ones that are going to be, that we'll be talking about as well. So I hope that you'll follow this, and we hope that you will be able to join with us in terms of joining first the network and then being a part of the virtual convening. So with that, I think I'm going to turn it back to you, Kailen, and I would certainly welcome any questions if anybody does have any at the end if you want.
Great, thank you so much, Meryl. And Meryl's email address will be on is on our list of emails at the end of the presentation. So if you want to contact her, you can. You can also type in a question during the webinar today, or you can raise your hand in the webinar and we can unmute you if you want to ask a question. So with those updates and not making a big content leap, we're going to get into talking about protective factors approaches to supporting resource parents. And by resource parents, we mean foster parents, kinship care providers, others who are providing support to children who are involved in the child welfare system. And so to begin that conversation, I'm joined by my colleague Leonard Burton, who is a senior fellow at the Center for the Study of Social Policy. And unfortunately, Rachel Paletta, also at CSSP, is not going to join us today. She's ill. So Leonard's going to be carrying the water on this presentation. And Leonard, I thank you for joining us.
Thank you. I appreciate being a part of this webinar. I hope you guys have had an opportunity to take a look at the CSSP website. I know Kailen just mentioned there's a link to Youth Thrive there, so I'd encourage you to go to the CSSP website and look at Youth Thrive. And Youth Thrive is one of the most recent initiatives at CSSP. It's both a research-informed framework that's based on the synthesis of research on positive youth development, resilience, neuroscience, stress, and the impact of trauma on brain development. And we focus on youth who are in or transitioning from foster care. And so we have worked on developing the protective and promotive factors specifically for young adults, young people aged 9 through 26. You see the 5 protective and promotive factors of resilience, social connections, concrete support in times of need, etc. At Youth Resilience, we want to make sure that young people are managing their stress and functioning well when faced with those stressors and challenges during those adverse times. Social connections, want to make sure that they have healthy and sustained relationships with people, institutions, their peers, a community, and seeing themselves connected to a greater sense of purpose and trust, and having the feelings of belonging for youth that really matter. Then the knowledge of adolescent development, although we wouldn't talk about knowledge of adolescent development with young people from scientific terms, but helping them understand that what their developmental arc is, and what they should be expected to do, how we as adults should be able to react and support them during their multiple transitions to adulthood based on the neuroscience. And then making sure they're connected to the right supports when they need them, as well as building the skills and attitudes that they need to form as healthy adults. Go to the next slide, please. At Youth Thrive, we're working on several things. They're listed here, and primarily you want to hear about the Kinship Parents Education and Support Project. But let me quickly talk about the exemplary programs. This was the first piece of work that was done at Youth Thrive after we compiled the research, and there's a 80-page research of neuroscience, brain development, etc., that helped us shape the Youth Thrive framework. We built an opportunity, or RFP, to identify some exemplary programs across the country who were working on healthy development and well-being. And Francie Zimmerman, my colleague at CSSP, leads that work. And there were 2 child welfare jurisdictions that became a part of the exemplary programs. That's Brevard County, Florida, and the state of New Jersey have been identified as exemplary programs that are implementing the Youth Thrive framework, working on the healthy development and well-being dynamic outcomes of being physically and emotionally healthy, optimistic, compassionate, and curious, having the ability to form and sustain caring, committed relationships, having success in school and in the workplace, and being of service to the community or society. So the exemplary programs have been doing that, and we continue to engage them on that front. We're currently working on some CHAFE recommendations, the federal CHAFE Act that is one of the most flexible fundings for young people in foster care, adolescents, and we're working on some recommendations to our colleagues at ACYF on how to connect those services and supports to the dynamic outcomes around healthy development and well-being. That should be forthcoming pretty soon. We have a youth engagement platform trying to engage more young people as we develop more materials and translating the materials into youth-friendly format. We're about to release a letter of invitation this week, tomorrow, to invite public agencies to join our learning community. We want to add 3 to 5 new public agencies to the Youth Thrive network. And it's not a grant opportunity, but it is an opportunity to be a part of this learning community, and we will select 3 to 5 by the middle of November. There's a webinar that's set for September 18th. Applications are due October 8th, and then we will notify, again, those jurisdictions by the end of November. Go ahead to the next one. My colleague Rachel Paletta, who couldn't make it on the call today, she and I have been working on this parent education and Kinship Parent Education and Support Project. Here are the results in front of you. We want to determine how kinship parents can use the Youth Thrive protective and promotive factors. And we're also looking for, and where you guys can help us out at, is we're looking for some key informants that we can survey or participate in focus groups to help us understand what is needed, how to translate and educate and support kinship parents through different methods, for example, training curricula, and various multimedia applications. And so if there's anyone who's willing to participate in a survey or focus group, we'd certainly appreciate you sending Rachel or myself an email.
All right. Well, thank you, Leonard. If anyone wants to, if that caught your interest right now and you want to raise your hand or type something in, please do. And I also want to make sure you know that there's a handout about Youth Thrive in the webinar handouts that describes some of the expansion of the learning community and the opportunity to apply for that. So check that out if you're interested, or download it and share it with others in your state or community that might be the right target audience for it. And we'll look forward to continuing to engage with all of you in both Strengthening Families and Youth Thrive, these shared sibling initiatives, I guess we could call them. Thank you so much, Leonard.
Thank you.
All right, so I'm going to share one other resource from CSSP that we're just releasing now. It's called Taking Care of Yourself, Tips for Kinship Care Providers. And this, again, was developed in partnership with our working group on strengthening families and child welfare. That includes 14 states that had been meeting on a bi-monthly basis for about a year and a half, I think. And they had provided input on a lot of tools that we were developing and that came out of some of their jurisdictions for child welfare practice tools. This one is a little bit different. It's really a handout for parents and for kinship parents in particular. So we wrote it to be relevant not just for those who are formally designated as kinship care providers, but for others who are informally caring for a child. We know there are a lot of grandparents raising grandchildren where that's not a legal arrangement or something done through the child welfare system, but they are caring for children who may have been exposed to trauma and who certainly just the moving between homes can in itself be traumatic. So we feel those are parents who need support, whether they're officially kinship care providers or not. This document focuses on the protective factors of the care provider and on what they can do to support the child's social and emotional competence. We put both Strengthening Families and Youth Thrive language into this, feeling that it was really about the caregiver's protective factors regardless of the age of the child. And we also included a trauma tip about each one. I just have a shot here of what this document looks like: taking care of yourself, tips for kinship care providers. And again, it's in the handouts for the webinar, and it will be posted on our website soon with a link in the e-update next week, or possibly early the following week. And just hope that you can use that. This is something that I think caseworkers could be handing out to kinship care providers. It's also something that you could just send to someone in your own family who's having that experience, or someone in your community that could use it. So I hope that will be useful. And I see we do have a couple people expressing interest in the Kinship Parent Education and Support Project, Leonard, so we'll be sure to get you their contact information. Thanks, folks, for typing that in. Okay, I'm going to now hand off to Robin Harvey from Be Strong Families, one of the co-leads for Strengthening Families work in the state of Illinois, and a national organization that's provided a lot of training and support around the country. Robin's going to talk about their work with foster parents and about shared parenting. Robin, are you there?
I am here.
Wonderful. Thank you.
Thank you, Kailen. All right, everyone. I'm Robin Harvey. First and foremost, I'm a mom. I'm a mom of 7 boys. 4 of those are adopted out of the child welfare system in Illinois. My husband and I served as foster parents for 18 years, and I am currently working with Be Strong Families as their Illinois statewide foster parent coordinator. Be Strong Families, if you haven't heard, our mission is to promote the empowered engagement of vulnerable parents, youth, children, and extended family members in ways that nurture the spirit of family, promote well-being, healing, and peace across the globe. And we do this with a major focus on developing respectful, strength-based, supportive services for child welfare-involved families and their children. We assist child welfare staff with enhancing their positive, effective working relationships with their clients. Here in Illinois, we work with the birth parents, the foster parents, the youth and young adults, the alumni, the youth who have aged out of the foster care system, and we also offer professional development for DCF and our private agency partners. I want to talk a little bit about the benefits of our work with Be Strong Families. In the last fiscal year, we had a total of 959 encounters with foster parents. There was 518 of those foster parents who we saw at least one time, unique foster parents. And then 441 times those foster parents returned to either a cafe or a training. We also offer a vibrant and dynamic Facebook group, and there's about 850 foster parents who convene on that group, for support. And then we also have BeStrongFosterParents.net, and that has almost 100,000 hits on it in the last 3 years. So some of the benefits that we're seeing is the increased resilience by the foster parents, because they realize that they're not alone. In my 18 years of fostering, the first 5 years I fostered basically alone with my own external support system. It wasn't until the 6th year that I met foster parents and understood the power of that social connection. We also increase the social connections by providing the foster parents in Illinois several opportunities to form communities. We have parent cafes regularly throughout the state. These help to increase the understanding of local resources and other concrete supports that are available for their children, their foster children, and their families. We help to increase the knowledge of parenting and child development through the conversations in our cafes and particular trainings. most notably living the protective factors. We offer foster parents a different way to communicate with the team members, and not just the child welfare professional team, but the birth parents as well. And I'm going to talk about the shared parenting program and how we do that in a second. Be Strong Families mostly uses peer-to-peer instruction with a trained facilitator. We follow the adult principles of learning, and it really is in alignment with the training program that Illinois has chosen to use, which is PRIDE. It helps the foster parents really dig in and understand their role in being effective foster parents and following the competencies. Our shared parenting program, it's called Building Collaborative Relationships with Birth Parents and Caregivers. We call it shared parenting. And shared parenting isn't a new concept in the United States, but it is one that we felt was needing to be highlighted and needing to be expanded on. Everyone knows that shared parenting is when the child, their parents, and the caregivers work in conjunction with each other and have more of a collaborative relationship. The foster parents and the parents, after going through our workshop, they have great things to say. Some of them say things like, it can make a huge difference to the child when the parents and the foster parents work together. It can instill safety and security for the children, not having to choose between them. Even in small ways, I can communicate and be positive in that relationship. During this workshop, the participants, which are 5 birth parents and 5 foster parents, we keep the group very small so it can be intimate and non-threatening to both populations. We do a peace circle to equalize the room and to begin to kind of remove that hero-villain paradigm that we often see between foster parents and birth parents. We brainstorm together the benefits of shared parenting, the benefits to the kids and to the caregiver and to the birth parent and to permanency. And then we utilize positive words, thoughts, and activities that build the collaborative relationship. And we do this through role playing. There is very little lecture, again, in the spirit of Be Strong Families. There is a facilitator, but we like to bring the wisdom out from the parents and the foster parents. The workshop is 3 hours long. It's, like I said, offered to a maximum of 10 participants, and it's not necessarily the foster parents of the birth parents' children. It can be any foster parent and any birth parent, because we believe that we need to start at the beginning and just start breaking down some of those preconceived notions that they have of each other. The workshop is led by a foster parent and a birth parent together. So Melissa Neely, who is the birth parent coordinator for Be Strong Families, is my co-facilitator, and we offer this as well to child welfare staff as professional development. We also offer a couple different services to the foster parent community, most notably the foster parent cafes. They're facilitator-led, peer-to-peer learning opportunities. They utilize the 5 protective factors in building up the foster family. They're offered throughout the state of Illinois, and both our public and our private agency partners utilize these. Some do monthly, some do quarterly. Sometimes we only see them once per year. I already mentioned the Facebook, articles, blogs, experiences, kind of anything that we can get our hands on to help a foster parent increase their skill in providing foster care. We share on there. And then we have our website. Our website, bestrongfosterparents.net, includes our foster parent blog. It includes video vignettes of foster parents who are in the field now. I'm talking about their experiences, most of the time a challenge and how they overcame it. We like to provide real-time advice and experience to any foster parent who is looking for that. And then all of our foster parents have access to any of the dynamic trainings that Be Strong Families offers, such as the shared parenting. We have a Wake Up to Your Potential with several different modules. This helps the foster parents set their goals and their vision and building a strong supportive team, among other topics. We have our 6-hour Living the Protective Factors training that takes a journey through each one of the protective factors on their own, helps parents build them at a higher level and embed them deeper. And then we have our BeStrongFamilies.net, and that has the rest of our offerings on there. The next slide is if anybody is interested in any of further information, any of our child welfare services. April Curtis, who is our child welfare director, that is her contact information, and she would be happy to field any of your emails.
Thank you so much, Robin. Can I ask you just a quick clarifying question?
Yes.
I know your main website is BeStrongFamilies.net, and then is it BeStrong? Yes. Sorry,
Foster Parents.
BeStrong Foster Parents is also .net, or is it .com?
It's .net.
.net. Okay. So both of those are .net. I hope people will check those out. You guys are certainly doing great work supporting those parents. I wanted to mention, I know that some folks from Wisconsin got training in the Parent Cafe model from Be Strong Families in Illinois, and in their counties in Wisconsin are now offering parent cafes that are primarily marketed to foster parents, birth parents, again, not necessarily parents of this, not the birth parents of the same child as the foster parents, but just trying to bring those communities together to better understand each other's perspective and to promote better collaboration around supporting each other and doing the best we all can together for the child. So that's an idea that has caught on a couple places, and it's exciting to see. So I want to hand it over to Kate from Rhode Island, who's going to lead a little bit of a discussion, and I hope many of you on the phone will jump in with your thoughts and questions and experiences. And again, I just want to remind you, you can always raise your hand in the webinar as a way to let us know that you'd like to be unmuted. And you can also type in and we will read off what you write. So Kate, want to talk a little bit about why you are doing this?
Yeah, great. Thanks, Kailen. Can you hear me okay?
Yes, you sound great.
Okay, good. So I had suggested this topic as one of the webinar discussions way back because I've always had an interest in figuring out how to bring this protective factors framework into that part of the child welfare system that deals with foster families, adoptive families, and birth families. Many of you who are on this call know that Rhode Island was one of the original 7 pilot states for strengthening families, and we have done a lot of things. We've seen a lot of things, but this is an area that's always had both a personal and professional interest for me. I support the Rhode Island Department of Children, Youth, and Families as a private consultant and do foster care home studies, and so I've been looking for ways to do this work. And Robin, your presentation is very exciting for me because I was not fully aware of what Be Strong Families was doing now, and you answered several of the, not necessarily questions, but concepts and ideas that have been floating around in this brain. But what I do want to sort of put out to the group as a whole, and invite anybody to be a part of this conversation, is if you're doing work similar to this, or you're working with foster families, kinship families, and finding a way to bring the protective factors, either training or the cafes, or however you're doing this, would you be willing to tell us a little bit about what it is that you are doing? So if you would raise your hand, and Trish will invite you to join us.
Or feel free to type it in and you'll be able to read it. This is always awkward trying to wait for people to raise their hands. If you have your own question as well, feel free to type that in and we can get to it.
While we're waiting for people to let Trish know, I One of the things that I've been wanting to do is to figure out how to really transform the foster care system in our state to do exactly, Robin, what you were just talking about, and that is helping foster families and birth families to have a better understanding and almost a compassion and empathy for each other that can then lead to a better reunification process, or even a better for the older youth that are not going to reunify necessarily with their birth family, but are going to go on into independent living, how we're able to foster connections that are better connections with birth families by facilitating these conversations around protective factors. So if anyone's doing that kind of work, I'd love to hear about it.
– Okay, nobody's raised their
Guess
hand
not.
yet. We have a shy crowd today.
That, or they're all saying, "Oh, we're not doing any of that." But gee, what a great idea, Kate! And you're so brilliant. And we'd love to do that too. Maybe we can invite Robin to come back on and just share a little bit, maybe about some unique experiences or aha moments that maybe have come up that could help us think this through a little bit.
And just before we get Robin going, I wanted to just mention that April Curtis wrote in that BSF, I'm not sure what that means, is doing it through our, yeah, okay, that's a really hard one to say. BSF is doing it through our work with youth and young adults. April is from
Illinois. Thank you, April.
Illinois, is it? Yeah, okay.
And I just noticed that Angela from New Jersey had her hand raised. Angela, I'm going to unmute you and see if you wanted to jump in, and then we'll come back around to Robin and Be Strong Families. Angela, are you there?
There's a couple more comments that have come in as
Angela Shivers, are you there? Okay. It looks like she muted herself. Are you there? Okay, maybe not. Angela, please raise your hand again if you do want to jump in, and we'll unmute you. But Robin, if you wanted to respond to Kate's question.
Yes, I'd be happy to. Be Strong Families, works with all of the different populations in child welfare in Illinois. I want to spend a couple minutes talking about the work that we do with the youth in particular. We do, right now we have been doing cafes about emancipation and independence using the promotive factors. And we discuss fostering connections with families, helping them find a forever family, whatever that may look like for them, having, people that they can count on, increasing their social connections. We have a new program called Wow Talk, which is words of wisdom, and that is using the promotive factors in a cafe style format, and this is led by teen facilitators. We have been training foster teens and foster youth and alumni to lead these discussions. We really believe that for Be Strong Families, each one of our populations can be best led by somebody who has been in that system. Our foster parent work is led by myself and several foster parent leaders throughout the state, and same with the birth parents and the youth work.
Robin, that's excellent, and I thank you for sharing that. I guess I have a follow-up question to that, and then I've got another question, I guess, to go back out to the group. But my follow-up to you would be, what kind of preparation work or parallel training happens with the child welfare staff so that when they're working with a birth family, they're sort of laying the groundwork and sending them your way, or even the youth that are aging out of the system, how do they get connected? I mean, is it just you get a list and you reach out to them, or are the staff, the caseworkers, initiating that connection?
That's a really great question, and there's a couple different answers. The first one is we work through several different advisory boards. We do have a contract with the Illinois DCFS this year to provide these services. So we work with the youth advisory boards and reach the young adults. I wanted to call them children, but they're not children. The young adults that way. We do that through each region, and we do that at the statewide level. And that's also true with the foster parents and the birth parents. We do partner with private agencies, typically the licensing workers. We reach out to all of the both public and private agencies to provide services. We do offer a wide array of professional development opportunities. We do the shared parenting, introduction to shared parenting, so the birth parents, foster parents, and the DCFS staff can share a common language and a common understanding of the shared parenting concepts. And we have done that with Youth Thrive as well. It aligns with the work of the family advocacy centers and DCFS, their work within that, the families that they're serving.
Great, thank you. Thank you. Someone asked that I repeat my initial question, and so I guess I don't remember exactly what I said, but the gist of it is trying to figure out who has been doing or has thought about doing some work around taking the protective factors framework and bringing it to resource parents, bringing it to birth families, so that not only are we building protective factors within their family unit, but really using it as a way to foster a new kind of a bridge, mentoring type of bridge between the resource family and the birth families, so that we're strengthening them so that we have successful permanent reunification and or at least fostering appropriate connections for youth with birth family members if they move forward and don't return home.
Thank you, Kate. This is Kailen. I'm going to read a couple things that have been typed in. So DeAndre Mayo-Wilson from Maryland talked about Maryland Family Network conducting parent cafes, and then also working with the Promise neighborhood in Baltimore, where they don't use the parent cafe model but have a parent education class called Parent University. And that's really focused on learning about development and engaging parents as teachers to their children. And is that specifically with foster parents, DeAndre? If you want to type in an answer, that'd be great. Or is that for parents in general? Just curious. And then Angela from New Jersey, Angela Wiggins, did type in a question and was wondering about how the parent cafes got started and how often they meet. And I think that probably varies a lot. So Robin, perhaps you can answer that, and if others want to chime in too about sort of variation. And then we do have one other question, so I'll read that, but first you can answer the question about parent cafes and how often they meet.
Okay, this is Robin, and in Illinois, it really does vary. It depends on the agency, the private agency or the DCFS office I'm working with. We have several agencies that like to have the cafes as a once-a-month meeting for their foster parents. These agencies are building community and really honoring the protective factor of social connections, making sure their foster parents don't feel alone. And then we have agencies that do quarterly, and then sometimes that just do a once in a while event for their foster parents.
Thank you. I think that covers, sort of the range of how people use cafes as well. And DeAndre, if you wanted more oh no, I'm sorry, that was Angela who asked that question. If you wanted more information about cafes in general, you can check out the Be Strong Families website, has information about parent cafes. There's a group in Washington State that started the community cafes. You can look up thecommunitycafe.com, I believe is their website. And we have a document on the Strengthening Families website about cafe approaches in general. So look that up under parent partnerships on our website. We have a few more comments here that I'll read. Tammy Stanwood from New Hampshire writes, I'm a child care resource and referral technical assistant specialist. I present training and provide consultation to child care providers and centers to help them support parents and families of children in their care. Also a member of the Strengthening Families Task Force in New Hampshire, and they have an annual conference for families and child care providers, and she is a foster and adoptive parent in New Hampshire. She says it's her first time participating in the webinar, and she's really interested in the work. I'm so glad you joined us, Tammy, and thank you for sharing that. As a foster adoptive parent and wearing your professional hat, I'm sure you're seeing a lot of potentially useful information here, and let us know if you want more information on any of that. A couple more questions. Let's see. Tisha Lowry is asking whether you give incentives for attending the Parent Cafe, and I guess in general for the kinds of events that you offer for foster parents. Robin, do you give incentives, or do people make ways to get there just because of the intrinsic value of it? I know either one could be feasible.
And I believe it's a little bit of both. I believe that they would come without the incentive, but there is the incentive of training hours. Our parent cafes typically can be used for DCFS training hours for foster parents, and foster parents need the 16 hours of continuing education over their 4-year license, and if they hold a specialized license, it's 54. So there is an incentive in that way. We do not provide financial incentives to foster parents to attend cafes.
All right, thank you. It's good clarification. DeAndre answered my question about the program in Baltimore that she had described in the Promise neighborhood, and said it's geared towards birth and kinship care parents, and many of the parents are at risk of being involved with CPS. A few have been referred. So thank you, DeAndre. I see that Florence Malone has her hand up, so I'm going to unmute you. And Florence, are you there?
Yes, I'm here. How are you today?
Great, and we can hear you perfectly.
Okay, I just wanted to talk a little bit about what we do with our parent cafes, or what we do to help support our families, because we have a lot of families, and I'm a parent coordinator for my daycare center, or a parent resource coordinator here in Cincinnati, Ohio. So what we do is, outside the parent cafes, we started following the model and having our own parent cafes, so they would have an opportunity to meet more often and have that connection with other parents that may be going through kinship or foster care or just birth parents, period, because we specialize in teen parents. Mm-hmm. But at the same time, we open our doors also to kinship parents and to, older parents. So in order for them to kind of just form a connection and have somebody to come to be able to talk to and everything, we started having events outside of parent cafes following the model. So they would have more chances to connect and more chances to communicate with one another, each other, and with us, to kind of let us know like what kind of systems they needed so we could help them for support-wise.
Great, thank you, Florence. And we have another comment typed in from Connie Dunlap in Wisconsin about that incentive question. She says each cafe provides a free meal and child care, so that's an incentive for parents. And that in Wisconsin we offer stipends to the parent hosts and child care providers since they're taking a more active role. So that is some resources going into providing those things, but making it easier and more attractive for parents to attend as well. Okay.
Kailen,
yes.
This is Meryl again, and I just wanted to add that the BirthParent National Network does do a lot of training, and we do focus on the protective factors, and we certainly do a lot of training around birth parents and foster parent relationships as well. And I just wanted people to be aware that one of the curriculums that has been a really effective curriculum in terms of building strong relationships between foster parents and birth parents is called a Better Together curriculum that is being done, and it was developed through Casey Family Programs. And actually New Hampshire, the state of New Hampshire, is very actively using that particular curriculum, and it's a 2-day training. It's an intensive training to build relationships and help the birth parent get a perspective of how the foster parent, what they go through when they have the child there. It talks again around that whole concept of shared parenting that was mentioned earlier today. And it also gives the foster parent a perspective in terms of what are some of the feelings that the birth family is going through too. So I just want to let you know the Birth Parent National Network is a resource where that kind of resource is available if you're looking for those kinds of things in the Strengthening Families Network for Protective Factors resources too.
That's excellent. That's great, Meryl. Thank you. This is Kate. I had one other thought, and I know we're coming up on the last couple of minutes for this call, but I was wondering if anybody has done any training of weaving this in for when people are learning to become home study providers, when caseworkers or whoever are doing home studies for resource and kinship providers, if there's some training for them on the protective factors and then how to weave that into even the home study process. And that might be a whole nother conversation, Kailen. But
That's a great point, though, Kate. I think there are a lot of individuals that make up these systems where even if you don't get without having full system change, you can get some of those key individuals who might be able to use a protective factors approach that would enhance how they're interacting with the families and how they're understanding families' needs.
Yeah, exactly, because, and I just throw this out there, when I went through the training, the SAFE training that is required by all persons doing home studies in the state of Rhode Island, whether it's foster care or adoption, that's a very punitive process. You're going in and you're investigating these families to determine whether they have the capacity and the appropriateness to be a foster family. And it's there's a lot of probative questions about trauma and behaviors and attitudes and so on, but there's nothing in there about building protective factors or even self-care. So I think it's something that's worth further discussion at another time.
Yeah, thank you. And DeAndre from Maryland typed in that she used her training as a CASA volunteer, court-appointed special advocate, which is great because I had just remembered I was in Idaho, I guess about a year ago, or I don't know when it was, but I was in Idaho at some point, and they were talking about giving Strengthening Families protective factor training to all their CASA volunteers and making some changes in the forms that CASA volunteers use to report to the family court, which were really interesting, that trying to frame even how the CASA volunteer would frame their report about the families to be in terms of strengths. And so not just to say, we have, last month there were 10 negative check marks here and now there are only 8. It would instead be, here's the positive changes the parent has made and how they relate to some protective factors, and then here's what we're still working on. But really that makes a difference in how the family feels when they walk into family court, and whether they feel motivated and validated in the work that they are doing to make improvements. So I think there's a lot of room for reaching the different individuals who touch the lives of families as they go through this system, that we can be much more strength-based and really think about the protective factors throughout that experience. And Tisha did write back in that she's a CASA in Lee County, Alabama. So spread this idea, all you CASA folks out there. I think it's a really interesting possibility. Okay, we have actually filled up the whole hour here with this great conversation. I want to thank everyone who presented, as well as everyone who chimed into this conversation. Thank you, Kate, for suggesting this topic and for facilitating the conversation and asking good questions. I want to just thank everyone. I put up the email addresses here Please feel free to contact any of us if you wanted to share information. Contact Leonard and Rachel if you wanted to get involved with the Youth Thrive work, and do please share those resources. As always, thanks for taking time out of your day to connect with us, and keep an eye on your inbox for the Strengthening Families e-update that will have links to a lot of the materials we talked about today. Hope you'll join us again next month, and I hope you have a great rest of the day. Thanks, everybody.